Hello and welcome back. Today we are going to talk about a general tour of the head and neck in terms of its anatomy. We're going to make a special emphasis on what it looks like in imaging techniques. Please don't walk away from this talk thinking that this is a comprehensive understanding of head and neck anatomy. All we're going to use this to do is to give a basic understanding of the principles of how the head and neck is arranged and what those key structures might look like when you see them on imaging. And the core to this story is the skull. The skull, although it looks like one continuous structure, is actually two structures held together. There is the cranial vault, the volume or the semi-spherical dense bony tissue that surrounds the brain, and then there's the facial skeleton. These are two independent parts to the skull. They're actually driven by different growth drivers. For example, if you look at a baby, a newborn baby, and look at the proportion of the cranial part, the bits surrounding the brain, versus the facial skeleton, you will notice that it's completely different to what you look like as an adult. The actual driving forces underpinning the growth of the face are completely different to the driving forces that grow the cranial vault. Clearly, the cranial cavity and the cranial vault are about protecting the brain, and thus, with many of you having some sort of physics or engineering background, you'll understand that its shape as a near sphere is to maximize that strength capacity to protect your brain. The facial skeleton, as opposed, is a skeletal structure that is actually designed to do other functions. Those functions being eating and breathing. And the precision of the arrangement of the bones and its structure are designed to do exactly that. For example, when you eat, the loads that are applied as you chew are applied vertically through these bones. So these bones are very toughened in the vertical axis. However, in the horizontal axis, they are actually very delicate. And that's why we wear a seatbelt when we drive, because we don't want our facial skeleton to come across a steering wheel or a windscreen or something in that direction. Okay, so let's move back now and have a look at what goes on inside the cranial cavity and some of the key features we should be aware of. Please, I've only picked some key features, so don't get too stressed about all the other features. This is a tour. And to start with, I'm going to talk about number 4. Number 4 is foramen magnum. And foramen magnum is the large hole where the spinal cord, in fact at this point it's the brain stem, exits from the cranial cavity. And through this hole, all the neuronal information that needs to flow down to your entire body exits through this foramen. If you look just behind it, where I've labelled number 5, this is called the posterior cranial fossa. And this whole region up to up to sort of the edge, the anterior edge of foramen magnum is called the posterior cranial fossa. And sitting in here is the cerebellum. That's sort of the small brain, as we call it, and that is responsible for much of the computation about smoothing out movement and allowing movement to happen in a smooth and integrated way. In front of 4, between 4 and 3, is that lumpy piece of bone there with a ridge. And that lumpy piece of bone, in fact 3 is pointing to some of it, is called the petraeus temporal bone. And for you, that's a really important piece of bone because that's a marker of where the auditory and balance structures are embedded inside that bone. And on radiographs, you will see those as open, airy canals embedded in the petraeus temporal bone. The temporal bone actually comes in two parts, that petraeus part and then a flat part that makes up the side of your skull. Number 2 is the pituitary fossa. The pituitary fossa sits in the midline, and that's a very important landmark for plain film images. We often use that as a marker to align plain film images, and in fact in some growth and development measurement systems we use that as a fixed point to taking measurements from. So that's the pituitary fossa. And just in front of that you can see sort of two ridges of bone running around, and those ridges of bone separate the middle cranial fossa. That's what number 3 is actually pointing at, the middle cranial fossa, from in front the anterior cranial fossa. And the anterior cranial fossa contains all sorts of parts of the cerebrum, and number 1 is just pointing to the cribriform plate, the little area where the olfactory nerve leaves to enter the top of your nose. And if you look to the side of that arrowhead, you can see the bone sort of looks a little dark as you go out to the edge of the skull there. That's because that bone is so thin you are looking down into the orbits below. So the nasal cavity, much of it sits between the two orbits. You can see the orbit, then the nasal cavity, cribriform plate, and then the orbit on the other side. And if we look more closely at the middle cranial fossa, we see this sort of arrangement. The red arrow is orientating you by pointing back at the pituitary fossa. The gold arrow is pointing at the jugular foramen that sits in the posterior cranial fossa. This is where the large blood vessel that takes the venous blood, the deoxygenated blood, out of the cranial cavity to head back towards the heart to then return through the lungs. This is the jugular foramen, and that jugular foramen sits just near foramen magnum, but before you get to the petraeus temporal bone. And the last feature I'm going to point out is where the green arrow is pointing. That little curve there is actually the curve of the indentation of the middle meningeal artery. The middle meningeal artery is an artery that actually supplies the coverings or the membranes that sit around your brain that then allow the liquid called the cerebrospinal fluid to separate it from the actual bony cranial cavity. And this middle meningeal artery is actually at risk of trauma. If you get a bang to the side of the head, you can do damage to this artery and end up with a subdural hemorrhage, which is a life-threatening condition. And just as an aside, that's why we have those little bits of plastic on the side of baseball helmets and cricket helmets to protect the temporal bone that overlies this middle meningeal artery. And now let's for a moment have a look at the other side of the base of the skull and see the various structures we can see here. Again, look at that large foramen magnum for orientation, and then look at the mandible, the dense bone that is the chewing bone that you can see towards the anterior area. And if you look just inside the mandible, you can see the palate there, the hard palate, which is the bony part, and hanging off the back of that hard palate will actually be a soft part called the soft palate that's sort of like a curtain with strings or muscles that can pull it up and down. What you are looking through the hard palate there at is the two openings to the nasal cavity. Those two large openings allow the air to flow from the nasal cavity into the pharynx. And the pharynx is a shared tube where air will flow down to enter your larynx and into your lungs, or at the same time, food and water can flow down the pharynx to then be transferred into the esophagus to flow down into your stomach. So those two large openings are the openings of the nasal cavity into the nasopharynx. And just behind it you can see two foraminae between it and the foramen magnum, and they are foramen lacerum, and they are large irregular holes that are just sort of somewhat of a quirk of development. So that's what the base of the skull looks like. And if we move to the facial skeleton, you'll see that there's a number of core features and bones, many bones in fact. I've labelled a few that I think are important that you need to actually do a little reading around. Obviously the maxilla, the large upper jaw that holds the upper teeth, but it also has the maxillary air sinus in it that you will see on many radiographs as an air-filled space in the bone there. The mandible obviously is a large dense bone, need to know about that, and the nasal septum you'll see often as well. Other facial bones of importance here is the frontal bone, the temporal bone. This is the flat part of the temporal bone as opposed to the petraeus part that you see inside the cranial cavity. And this flat part here, on the immediate flip side from that arrow, you would see that middle meningeal artery. And the last important one here that I want you to do a little homework on is the sphenoid bone. The sphenoid bone is the bone that actually has the pituitary fossa in it, and it sits deep at the back of the orbit and makes up most of the middle cranial fossa. So let's now move on and look at some imaging and see if we can see some of these key features. Here we have a cross section, and I'm immediately going to jump to number 4 just for continuity of our discussion. Number 4 is that petraeus temporal bone, and there is the canals or spaces that hold the auditory and balance systems. Where number 1 is the orbit or the eyeball, and you can see the one with the arrow on has that little black area at the front. That's actually the lens. If you look around the eyeball, you can see some paler white lines there, which on both the left and right eyeball, which are the muscles that help move the eyeball. These are the extrinsic muscles of the eye. And in the midline you might sort of see just behind the eyeball, particularly on the one with the arrow side, you might just see the optic nerve, which takes the information back from the retina in the eyeball, takes it back to the brain. Number 2 is pointing to the nasal cavity, and you can see all the bony projections that are within that nasal cavity, and those projections are there to increase the surface area of your mucosa, and that increased surface area of mucosa means the air on its turbulent flow through the nasal cavity is exposed to the mucus that the mucosa produces on its surface, as well as the large surface area of blood vessels, and this allows the air to be cleaned because the mucus collects any dirt and dust, moistened because the water in the mucus is evaporated and produces humidity in the air, and warmed because the blood obviously allows the transfer of heat across the membrane to warm the air. So that's why you see all those bony structures. And number 3 is just part of the cerebral cortices. Please notice that you can't see much detail because that's the type of radiograph this is, that you don't see much detail. This is a CT scan, whereas MRI scans, obviously because they pick up the differential density of water fundamentally, you can see much more detail in the soft tissues, whereas here you can't see that. And number 5 is pointing to that posterior cranial fossa, and in fact it's pointing to the cerebellum. If we go on and look at another section here, we can see some other interesting structures here. Just to orientate again, number 3 is the vertical ramus of the mandible, and number 4 is that pharynx that I talked about. You are looking at quite high up. Number 4 is sort of the border between the oral part of the pharynx and the nasal part of the pharynx, and that pale line just in front of the arrow tip of 4, that's actually the soft palate hanging down as like a curtain, and therefore it's being picked up in this slice. Clearly it can move, so this is seen here, but often it wouldn't be seen like this as well. whereas number 2 is a section through the tongue sitting in the oral cavity, and number 1 is part of the maxilla. And in fact you can see where on the arrows side you're starting to get a little bit of the undersurface of the maxillary antrum. I want to go back and talk about number 5 here. Number 5 is obviously the vertebra. The arrow tip itself is actually pointing at the vertebral bodies, and at the other side, opposite, you can see those 2 prongs pointing out there, and they are the spinous process of the vertebra, and they allow muscle attachments to assist in keeping the head upright and managing the movement of the vertebra. You notice that in the middle of this vertebra is that dark space, and that's where the spinal cord or brain stem runs. It does look like the bone itself is incomplete around there, and there's a little opening. That's true. That opening is actually the space between 2 vertebrae, because they sort of overlap in a way, and that allows the nerves to exit from the spinal cord to run out and supply the tissues in that relevant region. So this is the intervertebral canal that allows those nerves to run out from the spinal cord. Let's move on and look at one more. Here we can see more of the nasal cavity in number 1, and you can see a nice exemplar of the nasal septum running down the midline just in front of number 1 there. And number 2 is pointing to the conglomerate of air sinuses. Notice they look like little cells. That is probably partially the ethmoidal air sinus, and I think maybe it could even be the sphenoidal air sinuses, and these are just showing you those spaces. Do also notice in the petraeus temporal bone you can also see some of that auditory tube, and on the very outside, halfway between the arrow lines of 3 and 5, you can see the ear there as well. And let's get back to it. Number 3, as I said, is the brain tissue of the middle cranial fossa, and number 5 is the little projections of bone on the inside and the outside of the cranial bone there, the occipital bone. The protuberance on the outside is muscle connections or muscle attachments to enhance the muscle attachment on the skull to help keep the head upright. On the inside you can see the little pointing of bone there, that the attachment for the dura, that is a stiff connective tissue that is some of the membranes that cover the brain, and this stiff connective tissue helps to stabilize the brain inside the liquid bath that it sits. Please also note, back in the orbit, on the side away from the arrow tips, you can actually see a beautiful example of the optic nerve running back from the eyeball towards the skull, where it enters to then join the brain, and that allows visual information to run from your eye back to the brain. And lastly, on our images, we're going to have a look at this. Firstly, number 1 is pointing to the frontal bone, and again, like number 5, is that little extension of bone where the dural sheaths attach. But I want you to look at number 2 carefully. Number 2 is the ventricles. These are the spaces inside the core of the brain. Remember, I said the brain develops as a tube and remains a tube throughout your life. These are the ventricles, and inside those ventricles are the cerebrospinal fluid. The cerebrospinal fluid also flows around the outside of the brain in the subarachnoid space, and you can see that just at the top, just around from arrow tip 1, you can see the darkness there of the cerebrospinal fluid before you get to the paler cerebral hemispheres. So that is the cerebrospinal fluid. So let's go back and talk a little about the anatomy now. What I want to remind you is there's a lot of soft tissue structures also involved in the anatomy of the head and the neck, and in particular, this is just a diagrammatic representation, so you can see the glands, the nerves, and the blood vessels in this region. Clearly we have glands, and lots of glands, because we have to make the saliva in your mouth. And just as a quirky aside, you might like to know that cows, ruminants, produce about 200 litres of saliva a day. And in fact, you and I, we swallow about 1,800 times a day, and all but 200 of those swallows are just swallowing the pure saliva that we make in our mouth. So these glands are quite active in producing saliva. We also have lots of blood vessels, and I've just put this up just to show you a picture of the blood vessels running across the palate. But we have lots of blood vessels in this region, in the facial skeleton region, because we have lots in the nasal region, as I said, to allow the blood to assist in the formation of the mucus secretions in the nasal cavity, and also to assist in the transfer of heat to the air. But we also have it in all the rest of the facial skeleton, because this is a region where lots of antigen or foreign material is at risk of getting inside our body. And by having a large blood supply, we have lots of the defensive cells are able to defend us in that region. And later in the course, we'll have a whole session talking about the lymphatic system and the defense systems of the body. But blood is a very important carrier of those defense systems. And then I want to talk for a few minutes to say that we have a whole bunch of muscles, hundreds of muscles in the face and head region. We don't learn them as a list, we understand them in their embryological origin. In fact, we have one group called the muscles of mastication, and that group of muscles, although it sounds like they should just be the chewing muscles, the name is specifically because they are from pharyngeal arch number 1. So the muscles of mastication are large muscles, for example, temporalis, the large one you can feel on the side of your skull there. They are clustered together and called the muscles of mastication because they are derived from the first pharyngeal arch. The other set of muscles that we find in the facial skeleton region is called the muscles of facial expression. And although they do lots of the facial expressions, frowning and smiling and such like, their name is actually because they are part of the second pharyngeal arch for embryological origin. And I've highlighted one of those muscles of facial expression here in the yellow box, buccinator muscle. And by definition, if you are derived from a particular origin, you will get a particular nerve supply. So for example, the muscles of mastication, their motor supply is from the trigeminal nerve, the 5th cranial nerve. Whereas the motor supply to the muscles of facial expression are from the 7th cranial nerve. And the last set of muscles I want to highlight is the tongue. The tongue muscles are a little strange because most things in the head and neck are derived from pharyngeal arches, but the tongue muscles are derived from muscles of somites. The somites are the system, if you remember, that builds most of your body. So these are weird muscles that have migrated from somite territory to enter pharyngeal arch territory to be the muscles of the tongue. And just a few other little features that we should remember. There are lots of nerves in this region as well. The major nerve that supplies sensation to the face and external surface of the cranium is the trigeminal nerve. The trigeminal nerve starts its journey in 3 parts: a mandibular division that goes to the lower third, a maxillary division that goes to the middle third, and an ophthalmic division that goes to the upper third, providing sensation, pain, temperature, touch and proprioception to the face and the front of the skull. Just as an aside, remember I just told you also the trigeminal nerve has some motor function that supplies the muscles from the first arch, the muscles of mastication. And lastly, I just want to remind you that there are ligaments as well in this region. Now these ligaments are made of dense collagen, and historically we thought of them like chains that prevented excessive movement of joints. The reality now is we know that they have a whole bunch of sensory systems in them, and those sensory systems grab information and use that information to switch off muscle activity when the tensions get too high. So there are ligaments. In fact, I've just arrowed 3 of the ligaments here that attach to the mandible, and there's no need to worry about the names. And the last thing I want to remind you is that a whole bunch of this area, all of these tissues, need a blood supply and a blood drainage. We've talked about the intracranial blood drainage through the jugular vein. We probably should remember that the carotid artery is the major supply upward into the head and neck. The carotid artery is about 2/3 the internal carotid artery that supplies the brain, and 1/3 the external carotid artery that supplies the facial skeleton region. And if blood comes into a region, blood then has to flow out of that region through the veins. And we've already talked about the jugular vein being the major drainer of vein from inside the cranial cavity. And the external venous drainage is very complicated and highly variable, so we're not going to talk about it other than to say that there is this network of veins around your face that drain blood back, and at the end of the day they all join towards the internal jugular vein to flow back to the heart, to be pumped into the lungs, to be reoxygenated, and then to be recycled around the body. So that's where I'm going to finish today. I hope my whirlwind tour of the anatomy of the head and neck, with a particular emphasis on imaging and the anatomy that you will see in images, has assisted you, and I look forward to talking again soon. Thank you.